If you spend enough time reading men's health articles online, you have almost certainly stumbled across a headline that sounds too good to be true, claiming that ejaculating more can prevent prostate cancer. For decades, men have whispered about this concept in locker rooms and scoured internet forums, trying to figure out if it is a medical reality or just a convenient, sensationalized internet myth. Is there an actual magic number of times you should be climaxing every month? Does cleaning the pipes truly protect you from one of the most common cancers in the world? Or is it just wishful thinking? I am Dr. Judy Geller, a board-certified urologist and pelvic surgeon. In my clinic, I deal with the realities of male pelvic health every single day. Today, we are going to strip away the clickbait and dive deep into the actual peer-reviewed clinical science. I am going to explain exactly how your prostate functions, outline the fascinating biological theories behind this concept, and break down the major medical research findings that have completely changed how urologists view this topic. If you are a man over the age of 30, or if you care about a man who is, this is a comprehensive read you cannot afford to skip. Let us get to the truth. The Walnut-Sized Factory, Understanding Your Prostate. Before we can understand how ejaculation affects your risk of disease, we have to understand what the prostate actually is and what it does. Far too many men go their entire lives without fully understanding this vital piece of their own anatomy until something goes wrong with it. Imagine a gland roughly the size and shape of a walnut. It sits deep inside your pelvis, positioned directly underneath your bladder, and it physically wraps completely around your urethra, which is the tube that carries urine from your bladder out of your body. Your prostate is, essentially, a highly active manufacturing plant. Its primary biological function is to produce prostatic fluid. When you ejaculate, the sperm cells traveling from your testicles mix with this prostatic fluid. The prostate-specific fluid is rich in enzymes, zinc, and citric acid. Its job is incredibly important because it nourishes the sperm, protects them from the naturally acidic environment of the vaginal canal, and gives them the mobility they need to survive. Your prostate is constantly working, constantly secreting, and constantly renewing this fluid. However, as men age, typically beginning right around the age of 40, the prostate begins to undergo cellular changes. For the vast majority of men, the prostate tends to slowly grow and enlarge. In urology, we call this benign prostatic hyperplasia, or BPH. Because the prostate wraps around the urethra, this benign, non-cancerous enlargement squeezes the urinary tube like a clamp on a garden hose. This causes bothersome symptoms like difficulty starting urination, a weak stream, and waking up multiple times a night to use the bathroom. I must make a crucial medical distinction here. BPH is not prostate cancer, and having an enlarged prostate does not mean you will inevitably get cancer. However, entirely separate from BPH, the risk of developing prostate cancer also rises significantly as you age. The statistics are sobering, as approximately 1 in 8 men will be diagnosed with prostate cancer during their lifetime. This is precisely where our conversation about ejaculation frequency becomes incredibly important. The biology of cleaning the pipes. Why would the frequency of your ejaculations have absolutely any impact on your cellular risk of developing a malignancy? What is the biological mechanism connecting these two things? In the medical community, there is a leading theory designed to explain this phenomenon, known as the prostate stagnation hypothesis. To understand this hypothesis, remember that the prostate is a secretory gland designed to produce and release fluids. The stagnation hypothesis suggests that when you ejaculate regularly, you are actively flushing out the prostate gland. You are performing a routine maintenance flush of the pipes. When you do not ejaculate frequently, the prostatic fluid sits stagnant inside the glandular tissue. When fluids stagnate in the human body, they accumulate debris. The theory posits that regular ejaculation removes old, degrading cellular material, environmental toxins, and naturally occurring inflammatory substances that might otherwise build up inside the prostate ducts. Think of it like the filter in your home's air conditioning system. If you regularly cycle the air and clean the the system runs flawlessly. If you let the debris sit there for months or years, the system chokes and the environment becomes toxic. When inflammatory substances are allowed to sit and stagnate in the delicate prostate tissue, they can cause chronic, low-grade inflammation. In oncology, we know that chronic inflammation is a massive driver of cellular mutation. Inflammation damages DNA, and damaged DNA is the foundation of cancer. Therefore, regularly flushing these potentially irritating substances out of the gland may prevent the cellular damage that leads to tumors. There is also a secondary hormonal theory suggesting that frequent sexual activity might help regulate or optimize circulating testosterone levels. While the relationship between testosterone and prostate cancer is highly complex, men with naturally higher, healthier testosterone levels tend to have a lower risk of prostate cancer overall. The research findings, the landmark Harvard study. The theories make logical sense, but in medicine, we operate on peer-reviewed data. The modern conversation around this topic stems from a massive landmark study published in the highly prestigious journal European Urology. Researchers from Harvard Medical School and other top institutions followed a cohort of nearly 32,000 men for almost 2 decades. The study began in 1992, asking men to fill out highly detailed questionnaires regarding their monthly ejaculation frequency. The researchers tracked these men longitudinally all the way through 2010, strictly monitoring their medical records to see who developed prostate cancer. They compared men who ejaculated frequently to men who ejaculated a baseline average of 4 to 7 times a month. The findings were extraordinary. The researchers discovered that men who ejaculated 21 times or more per month enjoyed a statistically significant reduction in their risk of developing prostate cancer. To break down the specific numbers, men who reported a high ejaculation frequency of 21 or more times a month in their 20s had a 19% lower risk of developing prostate cancer later in life. Furthermore, men who maintained that high frequency into their 40s saw an even greater benefit, experiencing a 22% lower risk of prostate cancer. This study provided robust observational evidence that frequent ejaculation, whether through sexual intercourse or masturbation, was inversely associated with prostate cancer risk. The magic number of 21 times a month was instantly burned into public consciousness. The Southern Spain study, a deeper dive into risk. While the Harvard study gave us that famous metric, a more recent clinical study conducted in southern Spain sought to investigate this link even further. This study specifically looked at the crucial years immediately preceding a cancer diagnosis. Researchers recruited 456 men who had recently been diagnosed with prostate cancer and compared them to a control group of 427 men who were completely cancer-free. They heavily scrutinized their ejaculation habits during the one single year immediately prior to the interview or their diagnosis. The researchers grouped the men into 3 distinct categories based on their monthly frequency. These categories were low frequency at 0 to 3 times per month, moderate frequency at exactly 4 times per month, and high frequency at 5 or more times per month. The findings from this Spanish study were startling. The data revealed a stark contrast in the habits of healthy men versus men who developed tumors. In the group of men who did have prostate cancer, a mere 15% reported ejaculating 4 or more times a month. Conversely, in the healthy cancer-free control group, that number jumped significantly, with 26% ejaculating 4 or more times a month. But the researchers dug deeper to find the specific risk amplification. Using the highest frequency group of 5 or more times a month as their baseline for safety, they found that men who ejaculated exactly 4 times a month had a 64% higher risk of having prostate cancer compared to the highly active baseline group. For men who ejaculated only 0 to 3 times a month, their risk skyrocketed to a 138% higher risk. The most shocking statistic of all revealed that men who reported never ejaculating in the year prior faced a catastrophic 271% higher risk of prostate cancer. Furthermore, the link was not just about getting cancer, it was about the severity of the disease. The researchers found that low ejaculation frequency was even more strongly linked to the development of highly aggressive, advanced stage prostate cancers. This data strongly supports the prostate stagnation hypothesis. If the fluid is trapped and the man is not ejaculating to clear the pipes, the tissue becomes an environment ripe for cellular mutation. The bigger picture: do not rely on a single puzzle piece. Before you start aggressively marking your calendars and treating ejaculation as your sole medical defense plan, I need to deliver a massive dose of clinical reality. Prostate cancer is a multifaceted disease driven by genetics, environment, age, and lifestyle. These studies are observational. They show a highly compelling correlation, but they do not prove absolute causation. Ejaculating 21 times a month is not an absolute shield against genetics, and it most certainly does not give you a free pass to ignore the rest of your physical health. If you truly want to protect your prostate and lower your cancer risk, you must adopt a comprehensive approach to your pelvic health. There are several non-negotiable pillars you must build alongside your intimate life. First, you must prioritize a prostate protective diet. Your prostate tissue is highly sensitive to the nutrients you consume, so you must focus on foods rich in antioxidants. Lycopene, which is found in cooked tomatoes and watermelon, is scientifically proven to accumulate in prostate tissue and protect against DNA damage. Additionally, cruciferous vegetables like broccoli, cauliflower, and Brussels sprouts contain compounds that can actively suppress the growth of cancer cells. Second, cardiovascular conditioning is essential. What is good for your heart is fundamentally good for your prostate. Regular cardiovascular exercise improves systemic blood flow, reduces baseline systemic inflammation, and helps maintain a healthy weight. This is critical because obesity is a massive proven risk factor for developing aggressive forms of prostate cancer. Finally, and most importantly, you must engage in routine medical screenings. You cannot feel early-stage prostate cancer because it is entirely silent. You must commit to routine prostate screenings, which involves getting a prostate-specific antigen blood test and a digital rectal exam. If you are of average risk, you should begin discussing these screenings with your doctor at age 50. However, if you are at high risk due to being African American or having a family history of prostate cancer, you must begin these screenings at age 40 or 45. Early detection is the absolute key to survival. The final verdict. Let us return to the original question of how many times you should really ejaculate for better prostate health. The clinical data strongly suggests that more is generally better. Aiming for that baseline of 21 times a month, which is roughly 5 times a week, is associated with the most robust risk reduction for prostate cancer. Even if you cannot hit that specific number, the research clearly demonstrates that staying active by ejaculating 4 or more times a month is vastly medically superior to stagnation. Frequent ejaculation is a healthy, natural, and highly pleasurable way to maintain the structural integrity of your prostate gland and flush out inflammatory toxins. However, it must be viewed as a fantastic bonus habit layered on top of a healthy diet, rigorous exercise, and scheduled appointments with your urologist. Do not wait for symptoms to appear before you start caring for the machinery. Implement these habits today. Eat well, stay active, maintain a vibrant, intimate life, and please do not skip your preventative screenings. I am Dr. Judy Geller. Thank you for your time, your focus, and for trusting me with your health today. Take care of yourselves because your longevity, your health, and your intimate life are absolutely worth it.